Thank you for joining us. Want to go ahead and give you an update about our current situation in regards to testing numbers and also positive case counts. There have been 349 tests that we know about from Lane County going to our various laboratories. It's important to note that that number, 349, is thought to believe, or we think that it's a lot higher right now, that we're probably in excess of 400. We did receive some batch notification yesterday from one of our largest lab partners that helped us get up to the 349 number. However, just to be sure that our community knows that those numbers are actually likely quite higher. We have 7 positive cases. So yesterday we announced 2 new cases. I'd like to give you a few details about those cases, and really this is our effort to share with the community details that they may be able to use in terms of identifying symptoms within themselves, and then also just be aware of what's happening out in the community. So our first case that we announced yesterday is a female in her 60s. She did have a history of domestic travel to an area where there have been a number of cases. Her symptoms really started on March 16th with a cough and runny nose. Then they moved on to fever and body aches around the 20th, so about a 4-day ramp up there. And then on the 23rd of March, she was tested, and she is currently at home in a private residence in the Eugene-Springfield area. From our knowledge, she is medically stable and doing well, which is great news. Our second person, which we announced last night, was a man in his 30s. He was initially started experiencing symptoms on the 18th of March. Those symptoms started, and this is an interesting piece that we haven't seen here locally just yet. His symptoms started and have continued with GI symptoms, so primarily nausea and vomiting, which is really out of the norm for what we've seen so far. There was a cough and some fever and fatigue, but the real dominant symptoms that he identified within himself were those GI symptoms, so definitely a good thing for folks to be aware of. On the 20th of March, he was tested and then received the results just yesterday. He does reside in the Eugene-Springfield area at a private residence, and no public contacts have been identified for either of our cases, which is fantastic news. And again, if we did identify a public contact or a place where there were multiple potential exposures, we would notify the public after weighing all the options and our ability to make those personal contacts. At this time, I will go ahead and introduce Soraya Johnson, who will be giving our community an update on our unhoused efforts and what's being done on the ground there.
Thank you, Jason. Hi, I'm Soraya Johnson. I am working on our emergency support function for mass care and vulnerable populations. We have so far been able to set up 1 shelter and launch it this week at the fairgrounds here in Eugene. We have approximately, I believe, as of our last count, somewhere between 75 and 100 people currently in that shelter. We're working on making sure that our medical response at that shelter is set up and completely functioning. And then once we have that in place, we'll also be launching a shelter in Springfield that will house up to 100 people during this crisis. Our strategy on the shelters is to make sure that we have a place for people to find safety to sleep at night, as well as to have the resources they need during the day, like food and water and other basic supplies and provisions that are no longer available in the broader community, as many people were using the libraries and other open public places for this purpose. So we have that now at the fairgrounds, and we'll have that opening up in Springfield very soon. In rural areas, we've also been in communication with cities in those spaces. In Oak Ridge, we found that people in the unhoused community there tend to focus on camping in forest land and are not often congregating in the city of Oak Ridge, except for to collect food from the food pantry. So we've been suggesting to their city staff that they encourage the food banks to provide longer-term supplies of food so people don't have to come in quite so often, and to mitigate, again, the congregating and enhance social distancing practices in that space. In Cottage Grove, they have set up additional porta potties and hand washing stations in places where they know that people tend to shelter in encampments, and they're also making sure that food is available in 3 or 4 different sites around the city at certain times of day so people know when to go, and I'm sure also putting in social distancing practices for those spaces. In the city of Florence, they recently declared an emergency and now are also also working on finding some placement for 25 to 60 people who've been displaced from places where they typically camp. In Florence, we are told that most of the people who are in the unhoused population live in a trailer or an RV. And so at this point, the city is working on places to place them and working with their social service providers to make sure that food is available to those sites and places as well. And I believe that's the extent of our rural kind of communication at this point, but that's what we know about outlying areas. The City of Springfield is also working on distributing food and making sure that people have access to things that they normally had access to in public places, as well as Eugene. Thanks.
Thank you, Sarai, and I did notice that Sarai did not touch the podium. However, in an abundance of caution, we are disinfecting the surface and making sure that we are practicing what we preach. So, moving on, I want to give an update on PPE donations. Those are continuing to come into our North Delta warehouse. We are very grateful for everyone who has made those donations. We're working with our various partners at the cities and hospitals to make sure that we have one clearinghouse for those donations. That really ensures the equitable distribution of those PPE and just making sure that we have that spread across our county. As Sarai mentioned, we have been focusing on our rural areas and making sure that we are extending the same level of care and services out there. I was made aware just before we got on camera today of an individual who drove out to Florence late last night to make sure that they had a supply of PPE delivered out there, and that has been going on throughout Cottage Grove, South Lane, Junction City, Siuslaw Fire Department, our Florence Police Department, and various other places, Oak Ridge and Jasper Mountain, have been receiving PPE from these efforts as well. So that's pretty much in complete due to our community and their generosity and those donations coming into that North Delta location. So please keep that up. We are expecting some updates on how homemade masks can be used, and we have seen the news for other areas that have utilized them in order to make N95 masks last longer. And so while we wait for official recommendations, we are considering all those possibilities and how we would store those and how we would roll those out. And people have been writing into us and offering those homemade masks. So we really appreciate your passion and appreciate making those masks. So we will have an answer for you shortly on that specifically. I want to move on to a business update. As we have mentioned many times, our local businesses are being impacted greatly by the overall emergency situation. And in an effort to try to mitigate some of the impacts, we extended the emergency loan fund. And I just want to give an update. We have a little bit more expanded numbers on that. There were a total of 19 businesses who we were able to extend loans out to, certainly in the Eugene Springfield area. But I wanted to double down on the fact that we looked at all of Lane County as well, including our rural areas. And that's really where the bulk of the Lane County specific money, in addition to the two cities chipping in, was out to those rural areas. We're able to help a business in South Lane, 2 businesses in West Lane, 2 in North Lane, and 1 in East Lane. And we are looking to make more funds available. So, and just in terms of an overall idea of how many requests came in, the overall dollar amount, there were about 300 requests that came in, and about $1.5 million that was totaled up within those requests. So, a significant impact in our community, and our businesses are certainly feeling it. With that, we are pretty much done. I'd just like to double down on the message for folks to please stay home and do anything you can to possibly make that happen. We're aware of some neighborhood efforts that are underway for people to be able to help their neighbors stay home, and we greatly appreciate that. Anything our community can do, rally around each other and encourage that effort of limiting social contact, increasing social distancing, and staying at home whenever possible will really help us get through this in the best time. At this time, I will go ahead and open it up to any media questions.
So, Brian at KAZI would like more information on the positive test results. Are any of them in an apartment complex or building, and are those considered public exposure points?
So Brian Anderson from KZI would like to know whether or not any of our positive cases are in apartment buildings, or are those considered public contact points? So certainly when we are announcing our cases and when we are considering the information that we share, we consider the congregate living setting situations. And so that information, if it was a residential facility, a nursing home, something of that nature, then we would share that information. That's why we've been very specific about sharing the fact that they're in a private residence. And that no additional public exposures have been identified. And so, also looking at, you mentioned an apartment complex. So what we would look at in an apartment complex is whether or not there were shared facilities. Are there laundromat facilities that are shared there? Pools, et cetera, other things of that nature. And we would evaluate that if that was the case, and then make recommendations and public notifications based on that. So far, it's my understanding that we haven't encountered that.
Question from Jillian at KEZI. Can we clarify what county parks and campgrounds are open and closed?
So this is from Jillian at KZI. Can we clarify what county parks are open or closed? Sure, absolutely. So right now, what's closed are campgrounds and our dog parks. Really, there's only one dog park up at Armitage, but the campgrounds are really the parts that are closed. The day use areas and the boat launches are still both open, and we're keeping those open for now, contingent, of course, on whether or not folks are practicing social distancing. And so we'll reevaluate if we don't see evidence of that social distancing happening.
Alex at KVAL, how will the county keep the shelters hygienic and maintain social distancing?
The question from KVAL, Alex, I believe, from KVAL was is the county ensuring that social distancing is happening and there's just general hygiene happening at the shelter locations. And so what we have done is a series of trainings with our partners, and then also having an environmental health team down there to sort of oversee those efforts and making sure that we are doing the best that we can with the facilities. So if you imagine a large room that could have a capacity of 300-400 people, we're not putting that many people in there. That we're actually looking at a smaller capacity in order to encourage that social distancing happens, and then putting in place other measures to make sure that's happening. Additionally, we have hand washing stations and other sanitation happening on the ground out there, and have folks that are sort of wayfinders that are helping people understand the importance of it and directing them to that. Additionally, as we start to identify individuals with symptoms, we're making sure that the people who are working with those individuals know exactly what the recommendations are for working with those individuals, including wearing proper PPE.
Question from Tatiana at the Register Guard. When will the second shelter open?
Question from Tatiana at the Register Guard. When will the second shelter open? So we're looking for that to happen this week. We received approval for the shelter yesterday and are actively working to get that set up with our partners. And so we're looking at some rapid progress and something to be happening this week.
Couple of questions from KLCC, Rachel. With the 3 new cases announced this week, do we expect a bigger ramp up in cases?
So this question is from Rachel at KLCC. Do we expect, with the announcement of new cases this week, there's been 3 just in the last couple days, do we expect a ramp up of cases? And I think the answer is yes. I think we have really identified the fact that we believe that the virus is here in our community. We have evidence of community transmission, so it is spreading. With that, we can start to expect those more severe cases come into the hospitals, and that's really what we're seeing on a lot of these cases is those represent our most severe cases. So we should see that number go up, as well as just individuals who are experiencing symptoms of the virus, which again underscores the importance of staying home for everyone.
Rachel, again, what is the cost of running the shelter at the fairgrounds?
Rachel, again, what is the cost of running the shelters at the fairgrounds? I will have to get back to you on that, Rachel. That is a fine-tuned question that I think deserves an email response. So thank you.
Alex at KVAL, is there anywhere that the in-house can shower now that public pools and gyms are closed?
Yes. So the question is, are there places where the unhoused can shelter? Yes, there are places. Shower? Yeah, so the question is, are there places for the unhoused community to shower now that most of the facilities are closed or going to limited operations? And the answer is yes, there are places. We have made showers available, and through our outreach teams and through those emergency respite shelters, our unhoused community is aware of where those showers are and how to access them. With that, we will see you all tomorrow. Thank you.